Hi, my name's Ilan Lieberman. I'm a consultant in pain medicine, and I just want to say, first of all, thank you very much for asking me to present at this town hall meeting. It's really a very exciting thing to do, and I've never done anything like this before, so just bear with me. So, in order to answer that, I think the best thing for me to do is to really just give you a bit of a view of my career. I've worked as a pain medicine doctor for the last 20 odd years in Manchester, and that's really involved seeing people in clinic, trying to explain to them what's going on, maybe doing some interventions, sometimes starting some medication, and then seeing them on an ad hoc basis for follow-up, sometimes putting them through to clinical psychology and sometimes onto a pain management program. And what struck me over the years is that after you've been through a clinical service, what you really need is long-term support. I think what's crucial is how you support people going forward in the long term. And I think around that, what's very important is how you onboard them into that process and how you help them to understand their chronic pain and how you help them to understand how they live with it. And that's really a biopsychosocial, holistic, resource-based approach. You give people the education tools and the support around living with their chronic pain problem. And I think that tailoring lifestyle medicine and health coaching, I think that's the ideal mix. So the next question really is, what models of community-based support for persistent pain do you believe hold the most promise for being effective? Okay, so I've developed a health coaching platform because I think the evidence base for health coaching being a primary part of the solution is overwhelming. There's lots of data on it in the literature. So sort of diving deeper into this, how would I elaborate what I perceive as the key deficits in sustained community-based support for people living with persistent pain? What type of support is lacking? I mean, essentially, health coaching is what's lacking. And I know that I'm saying the same thing again and again and again. And I know that I might be sat here looking like I'm advertising my business and my service. But I got into this because I felt that what was lacking in what we were doing in chronic pain in the community services that I've helped develop in Manchester and in our secondary care service is being able to afford long-term, supportive, nurturing care for our patients who struggle with chronic pain. That continued understanding of what's going on and that relationship building and that guidance towards a change in a lifestyle, healthier living, goal setting, pacing, and improvement, and having a listening ear the whole time with a reflective, resource-based approach. That's what's lacking, and that's why I think health coaching is really useful in all of this. I don't think there are any regulatory and policy hurdles, essentially. I think the big hurdle is, first of all, access to platforms like the one we've developed, and second of all, the willingness for commissioners to make the bold decision that new way of working with the large language models and the AI and human health coaches so that we can build scalable, long-term care for our service users. And so I think, in summary, that lifestyle medicine and health coaching are the perfect marriage. I've had the privilege of knowing Lorimer and Deepak for quite some time, and I've only got the highest admiration for the work that they've done and the things that they've achieved. So thanks for the opportunity to talk to you about health coaching. I'd welcome any of you to download the app and be coached for free. I've just included a wee demo of what it looks like and what the onboarding looks like so that you get a feel for it. But thank you very much.
After downloading the Alifia app on either the Apple App Store or the Google Play Store, you answer a few questions so that we can personalize the coaching just for you. Once you submit your answers, an Alifia health coach welcomes you. You can view our extensive video library on chronic pain and fibromyalgia and then build a relationship with your coach by messaging them directly. When ready, you can go to your profile section in the top right-hand corner. Here, you can set your first goal. This goal is personal to you so that you can make lifestyle changes at your own pace with the support of your coach. And by completing this goal, you can take the first step in becoming healthier and happier as you take back control from pain.